I'll answer the question why one shoulder can be higher than the other, why a person looks at himself in the mirror and sees this. How can this happen? Why does this happen? First of all, such asymmetry might occur due to different tension of the oblique abdominal muscles. The oblique abdominal muscles are attached to the ribs and the pelvic bone from below. There are external and internal abdominal muscles. The fibers of the external oblique abdominal muscle go in this way. From the sides to the center, they go here. The fibers of the internal oblique muscle of the abdomen go in the opposite direction. That's their direction, backwards. The fibers of the external oblique muscle go forward. With a difference in tone, for example, of the external and oblique abdominal muscles on the right and left, such asymmetry will occur. That is, the body will lean towards the side of the shorter oblique abdominal muscle. Also, in this case, several options are possible. A rotation of the rib cage is a possibility. That is, it rotates around the axis with the formation of a rib hump. Even that can happen. It can happen. For example, from this side, we have a short external oblique abdominal muscle. The rib cage will turn to this side, that's how it will be. And from this side, we have a shortening. Let's say the internal oblique muscle will get shortened. Which direction of the fibers is like that? Accordingly, the whole rib cage will turn here. All this happens because of the following facts. If we have a short external oblique muscle here, this means we have a weak internal oblique muscle, and vice versa. These muscles are fixed in this direction because of it. And there is a change in the position of the rib cage. There may even be the formation of a rib hump. If there is a strong shortening, this then causes a deformation of the ribs. In addition to this, the position of the shoulders will change. There are cases when both the external and internal oblique muscles are turned off from one side at the same time. Let's say, I fell on my side from the right side, broke my rib. Several ribs turned off for me, damaged the attachment points of the oblique muscles of the abdomen. And so this whole half of the rib cage will be lifted up like this for me. And on the other side, all of this will just be compensated because the muscles do not balance each other out. On the other side, both the external and internal oblique muscles will be shortened. I'll be like this, all crooked. And I'll walk exactly like this, that is, I'll have this kind of step. With every movement, I'll make this kind of motion. Because on this side, the oblique muscles don't work. And instead of one muscle contracting, the second oblique muscle will immediately start contracting from one side. Both the external and internal oblique muscles, that is. This is the first reason why asymmetry forms on the shoulder. Asymmetry forms on the shoulder, but it's not about the shoulders. It's about the oblique muscles of the abdomen, which, by the way, is one of the most common reasons. Another similar reason could be not even in the shoulders, but in the foot, for example, the foot arch. If a person falls on this side, his shoulder will also be higher and the other lower. Well, I'll talk about that in one of the next videos. The next reason is also quite common of why the asymmetry forms. One shoulder is higher, the other shoulder is higher. It's disruption in the fixation of the shoulder blade. That is, in the first case, we have the entire rib cage like this. It raised like this. In this case, the shoulder blade changes its position. It is in the thickness of the muscle. And so, it just goes up like this. This happens because the muscles that hold the shoulder blade down, mainly the broadest muscles, the lower trapezius, they lose tone, they weaken. On the other hand, this muscle continues to work, and such an asymmetry is formed. Because, for example, the latissimus dorsi muscle 1 on my right has turned off, and so the shoulder will rise up. It will rise up because the latissimus dorsi muscle is weak. To compensate it, there will be a shortening of the upper trapezius, or the muscles that lift the shoulder blade. Here are the muscles that lift the shoulder blade, the antagonist of the latissimus dorsi. Why else can the shoulder blade rise up like this? Again, this can be a shortening of these two muscles. This is the upper trapezius and the muscles that lift the shoulder blade. In addition to the weakness of the latissimus dorsi muscle, this shortening can also occur because, well, for example, the shortening of the muscle that lifts the shoulder blade can also occur due to the weakness of the long neck flexor. If the long neck flexor is weak, something has to hold the neck so that it doesn't fall forward like this. And next to the long neck flexor is a muscle called the levator scapulae. That's its name. And it is capable of compensating for the weakness of the long neck flexor. And instead of it, it turns on, but this is not its function. So gradually it increases in volume because of this. It shortens. There can be fibrosis, a change in muscle structure. Due to its shortening, the shoulder blade position changes, moving upwards. Another reason for the shortening of the trapezius without the weakness of the latissimus dorsi muscle is the instability of this joint. This is the acromioclavicular joint. It should be held by the front and back of the deltoid muscle. They intertwine here, as if fixing this acromioclavicular joint. If this doesn't happen, then the upper trapezius tries to hold this joint, which also attaches to this joint, that is, it tries to stabilize it. But at the same time, it needs to be constantly tense, which also causes the shoulder to rise. So, how to get rid of all this? The first thing that comes to mind for some doctors or masseurs who try to treat such problems, seeing a person with one shoulder higher than the other, they first start working with the shortened muscles, because they are quite easy to find. For example, there is no trouble at all to take and find a tense trapezius muscle. It will cause pain for the person. And what comes to mind immediately to an inexperienced therapist or doctor? He starts to relax it. So he relaxed it once, everything seems to be fine. However, the patient comes to the next appointment. He has the same thing, it is just as tense. He tries again and again, then he makes some kind of block there. In the end, he still can't get rid of this shortening. And the shortening is here because it's the only thing that holds this joint, this muscle, or the only thing that holds the neck. And he tries to remove this shortening. That's why here we need, first of all, to understand why this muscle is short. Let's say the upper trapezius is short because the joint is unstable, the acromioclavicular joint. Then we need to understand why it is unstable, remove the cause, and only then deal with shortening the trapezius. The same applies to the cause of latissimus dorsi muscle weakness. First, we need to activate the latissimus dorsi, find out why it turned off. Maybe these are trigger points, attachment sites. Maybe something else. Maybe it's a disruption of the muscle innervation. Because while the antagonist is weak, the other muscle will always be short. With oblique abdominal muscles, things are also not so simple here. Here too, any massage therapist or any other specialist will immediately notice. He will find a shortening of the tension of certain muscles. It's not a problem to find a tense oblique abdominal muscle and start relaxing it. But there will be no result if we do not understand why it is weak, this oblique muscle. That is, first of all, we need to find out why the muscle is constantly tense. No muscle wants to tense up and maintain that tension just for the fun of it. So, something forces it to do this. Here, with the ribs, there is a special treatment tactic. That is, to activate the oblique muscles, we need to make all the ribs move in the necessary volume with inhalation-exhalation, as they should. There should be no shortening of the intercostal muscles. There should be good movement in the ribs on the transverse joints. and accordingly to remove the weakness of the oblique muscles of the abdomen, if there is any. This can be the cause of the place of attachment to the ribs, to the lumbar bone. These are the main reasons. So, to remove this asymmetry, we need to identify the cause for which this all happened and act specifically on it. Then there will be a result.